In November 2012, Matthew Leahy was admitted to a mental health unit. Within 6 days, the 20-year-old was dead. His mother's fight for answers led to an inquest this year which found a series of multiple failings and missed opportunities over a prolonged period of time.
We as a family thought we would find in the best help possible for our son. Clearly we didn't, and that'll live with me forever. And the sad bit is that people continue to die there.
The unit where Matthew died is the Linden Centre in Chelmsford. We've obtained this footage from a former patient. After Matthew's death, it was recommended the door hinges on these wards should be changed, as their poor design could enable a patient to hang themselves. In February, the Care Quality Commission conducted a surprise inspection of the Linden Centre and found 2 breaches of regulations. Care plans and risk assessments weren't detailed enough to keep patients safe, and the door hinges, so long identified as a potential risk, had still not been changed. But despite these warnings, 3 months after the inspection, another inpatient took his own life. Nadine was on the ward when the man died in May. She has dissociative identity disorder and has been admitted to the Linden Centre on several occasions. During her last day, she made a serious attempt on her life.
When I was focused on doing it, it was easy, and it shouldn't be. When the management and the trust is told, OK, this is how they did it, this needs to be changed, they should listen.
Another patient filmed this potential risk.
Every single room, they come off.
The heating controls can be removed, allowing access to cables and a place to hide objects.
But we could electrocute ourselves.
Every time I've been in there, I've ended up putting something sharp inside one of those little panels. You just can clip them off the wall.
When the unit is full, people have had to sleep on mattresses on the floor. Patients we've spoken to have told us, I slept on a sofa for 6 days. I've never felt safe in there, and it made me 10 times worse. One current inpatient wrote, I've been in so many hospitals all over the place, but the Linden Centre is the worst one I've ever been in. Please, none of us asked to be like this. We all need help and understanding. Is that asking too much? The Linden Centre is run by the North Essex Partnership University Foundation Trust. In response to our investigation, the Trust says a full action plan is being implemented as a result of last February's inspection. All the door hinges have been changed and all identified risks are assessed and managed. We aim to always meet the needs of the patient requiring urgent care. The Trust adds, mental health services across the country have been faced with real terms budget reductions for the past 5 to 7 years. Melanie says she'll continue her fight for an independent inquiry into her son's death.
It's a wound that's never going to heal, but each time something else happens to somebody else, it's a wound that reopens.
Nadine's motivation for speaking out isn't to shame the Linden Centre, but to improve it.
I don't want it shut down because there's nowhere else for us lot. When we get poorly and we need to be looked after, really for friends and family's peace of mind as well. They want to know that you're somewhere safe, looked after, with people they can trust. That place is supposed to be safe for everyone, and it isn't.